Hi everyone and welcome to my channel. As you know, my name is Cheryl and I am a CBT therapist, and I provide CBT therapy and treatments for people that are experiencing a range of mental health difficulties to try and help them feel better. So in today's video, I'm going to be talking a little bit about what CBT is. What exactly is it? What does it stand for? What does it involve? How does it work? And basically just letting you guys know, because I know some of you might be here thinking, what is CBT? Like maybe you've never had it before, or maybe you've just never even heard of it. So let me tell you a little bit about what it is and how it can help with various different difficulties. So I'm going to talk a little bit about what it's for, maybe a little bit about the therapist and their training and how they are trained to deliver CBT. I will also give you certain examples today just to kind of help with the understanding. I'm just going to use maybe two quite easy examples or quite simple examples. I know that mental health is very complex and there's lots and lots of different disorders that we can treat, but let me just start off with some really kind of easy examples today, and then maybe later on in my channel I might go into a bit more depth around some other mental health difficulties and what could show up and the kind of things that we might do in treatment. And I'll also tell you a little bit about where you can go to get CBT therapy, the different places, and then I think that's about it. So let's start off with discussing what is CBT. So CBT is like the short word for cognitive behaviour or behavioural therapy. And as it says in the title, we're looking at the cognitive, which is the cognitions, which is referring to our thoughts and what we're thinking, our thinking habits and our thinking processes. And then we're also looking at the behaviours. So what we're doing or not doing. So when we're experiencing symptoms of depression and anxiety, what are the helpful behaviours we're engaging in and our coping strategies, and what are the unhelpful strategies that we may or may not be engaging in. Within CBT, what we want to be doing is looking at how we can reduce some of those unhelpful coping strategies that we may be engaging in, and then how can we do more of those helpful and healthy coping strategies to alleviate some of the symptoms and help us feel better. So CBT therapy is specifically for mental health difficulties, right? And there is a range of different ones, and there is lots of them with varying different symptoms and presentations. And we can find these within the manual, the DSM manual. So this is what we use here in the UK. I know America and other places maybe they might use a different manual, but specifically here in the UK we do use the DSM-5. So CBT therapists are specifically trained quite heavily. We go through quite an intense study process, rightly so that we can assess certain symptoms of various disorders which show up in the DSM-5. Now, we can't give specific diagnoses because these can only be done by a psychiatrist. However, we are trained to recognise certain patterns, certain different presentations to be able to give you a probable diagnosis that, most of the time the clients will relate to. Then once we have discussed that probable diagnosis and shared that with the client, then we will use the CBT therapy to provide certain tools and strategies to try and help them feel better. So we will look at the probable diagnosis and we will have certain tools, strategies and processes that we have been taught that we've learned, that we've practiced on ourselves, that we've practiced on other people, until we become a competent CBT therapist. And then, we can deliver those tools to our clients. Now, I describe CBT as being a little bit like a personal trainer in the gym. So what I say is, when you go to the gym and you have a personal trainer, yes, they are going to teach you various exercises, they're going to show you how to do them, and they will recommend which ones are going to be best for you. Now, if you then don't do the exercises, it's not going to work, right? So it's really, really, really important with your personal trainer that you go to the gym regularly, you practice those exercises so that you can reach your goal, whether that's losing weight or becoming stronger or whatnot. Now, clearly, if you don't do the exercises, you're just going to stay the same, but maybe even get worse. So this is similar to CBT in the sense that your CBT therapist is your coach. So, they are skilled in the various tools and they can teach them to you. They can show them what to do, show you what to do. They can also demonstrate the tools and the strategies, and then they can set you a plan and say, practice this a couple of times a week. Now, if you only practice it once a week or once every couple of weeks, you may notice a little bit of change, but the progress is going to be quite slow. And then also your recovery may also then, take a long time. Alternatively, on the other hand, if you take the tools and you do practice them regularly, a few times a week, or especially at the beginning when you've just learned the tool and you practice them on a regular basis, it will become easier to do the tool, and then, hopefully you will feel much better. Now, of course, sometimes some difficulties may come up within the CBT therapy once you try them, but this is why it's really, really important to maybe do it quite early on, so then you can see the roadblocks, and then you can discuss them with your therapist, and then hopefully your therapist will know what's going on, and then yes, they can support you. Maybe it's that you don't understand the tool properly, which is fine, it happens. It takes us a long time, sometimes to practice the tools as well and to learn them. It definitely takes repetition, and support from somebody who is an expert and competent in the tools as well. So, when we're at uni, we have supervisors and other skilled CBT therapists that are modelling the tools and supporting us and giving us some constructive criticism, so that, we can improve it. And we're here to support you with that as well. We definitely don't expect you to be perfect. When we teach you and maybe you try it the first couple of times or the first couple of weeks, you don't have to do it perfectly, but the important thing is that you do try and you do practice, because if we think back to that gym analogy, if we don't do the work, we're not going to see any change. So that's really important. Another little analogy that I like to tell my clients, particularly if they've maybe never had CBT before, is CBT is like being in a rowing boat. Okay, stay with me on this one. We're not really in a rowing boat, but this is what I mean. So let's imagine that we are in a rowing boat together. So I'm the CBT therapist and I've got my client. Now, let's imagine I'm the one that's doing all of the rowing. What's going to happen? Right, we're going to be going around in circles. So what do we need to do? That's right, we need to both be rowing together. So the CBT therapist is going to be rowing, they're going to be asking you questions, they're going to be making sense of what's going on, then they're also going to be feeding that back to you and giving you certain strategies and tools for you to go away and practice. Now, if you then do go away and practice the tool, and you use the worksheets, you do the reading to learn about your symptoms, and you practice it, then you're doing the work as well. You're also doing the rowing, and then hopefully together you're going to be going in a straight line. Now, maybe there might be a few hiccups in the way, and we might have to stop the boat and recalibrate and figure things out together. But ultimately, we're sort of going to be moving forward because we are working together. Now, if, for example, the client is doing, or the patient, the client is doing all the hard work and they're talking, and the therapist doesn't understand, or they're not able to give you the tools, or for whatever reason that that we're running out of time, there's no moment to step in and give you the tools, again, we're going to be going round in circles. So this is another thing. The therapist, the CBT therapist, may interrupt a client during their CBT session to, step in, make sense of things, and then give you the tools. It's really important, towards the end of the CBT session, or maybe even halfway through, to start discussing the tool, and then especially at the end, give the homework, which is going to be the CBT practice outside of the session. It's really, really important. Now, if you run out of time and it's just talking, this isn't effective CBT, because CBT is about giving you the tools and then setting the homework task for you to do outside of the session. So hopefully that makes sense, guys, what kind of CBT is. So remember, we're looking at our thoughts and our behaviours. We're looking at what may be helpful, what's our coping strategies, and then also what may not be helpful, that's maybe making us feel worse. Now, it may be that you say to me, oh, well, Cheryl, it doesn't make me feel worse, it makes me feel good. So, people will say to me, I had an argument with my partner, and then I went home and I drank a few glasses of wine and, binged on lots of chocolate and pizza and crisps and things. And they'll be like, I felt great in the moment. But then I guess what we're looking at is this cycle of, in the short term, it may not be so bad. However, in the long term, if we are constantly doing this over days, weeks, months, we're going to be feeling worse, isn't it? Because we know alcohol makes us feel depressed. If we are eating too much and binge eating, we're going to gain weight, and we're also going to feel kind of sluggish and things like that. So one thing we definitely want to look at with the CBT is what's happening in the short term, in the long term, and what's going to be more helpful for us and help us feel better, rather than make us feel worse later down the line. So, as I mentioned before, CBT is for various depressive and anxiety disorders, also maybe possibly for certain personality disorders like BPD or narcissism, one of my favourites. To look at and to work with. But today I'm just going to focus on two, as I said, kind of simple examples. So let's maybe start off with a little bit of a depressive episode or a depression cycle, and then I'll go into a bit more of an anxiety cycle. So within a depression cycle, we are looking for certain symptoms. So it could be something like low mood, lacking motivation, lacking enjoyment, feeling quite tearful, lacking energy, these kind of things. So we tend to see a kind of like reduction in energy and a reduction in behaviours as well. There sometimes is quite a bit of isolation, and usually there's quite a bit of avoidance as well. So what we want to do is we want to recognise when that's coming up. We want to look at the triggers. We want to look what's happening when those symptoms arise. So if it is isolation, if it is drinking too much alcohol, if it's binge eating, if it's cancelling plans and not following through on certain work projects or studies, we want to give you a certain tool or strategy to break out of that cycle and to be able to show up and still follow through with helpful behaviours, whether that's eating well, whether that's going to the gym. That's what we want to be looking at. So let's think about something that could maybe cause a depressive episode. So let's maybe think about a specific trigger. So let's say we have text a friend. You know, we want to meet up with a friend. We want to arrange going out, maybe going for coffee or for lunch. I love coffee. So we've texted a friend and, you know, we've waited a few minutes and there hasn't been a text back. Now, some people who are very sensitive to depression, it could just be a couple of minutes and then we start panicking, thinking, you know, this person doesn't like us. And for other people, maybe it's slightly longer. But in this example, let's just say it's been a couple of hours and the friend hasn't texted back. Now, if we were not experiencing an episode of depression, we might just have some neutral thoughts. So we could be thinking, this person's busy, maybe they're at work, maybe they've had an emergency, you know, maybe they're just having some self-care time, they'll get back to me when they can. And we might think, if we don't hear from them, you know, in the next couple of days, maybe we'll try and call them. Now, on the other hand, if somebody was experiencing a depressive episode, it's quite likely that they would start experiencing what we call our negative automatic thoughts, or NATs. So, as it says in the title, these tend to be very negative thoughts and it's almost like they're automatic. We don't really have to put too much effort into it. They just pop into our mind and then they affect how we feel, right? So some of the negative thoughts that some people may experience within a depressive episode is, you know, they don't care about me, they don't like me, they hate me, they think I'm horrible, they think I'm ugly, they think I'm fat, they think I'm stupid. You know, the list could be endless. But yeah, those may be some common ones that come up within the depressive cycle. And as you can see, they don't feel very good. You know, even when I say it out loud, it doesn't feel good. So, you know, we're going to feel sad, we're going to feel low. Then what's going to happen is it's going to have an impact on our behaviours. So if we're feeling neutral, we might be able to carry on with our plans. On the other hand, if we're feeling low and depressed, we may listen to that behaviour and yeah, maybe we might go to bed and be crying in bed or just overthinking things. Maybe we just slump in front of the TV and we might be comfort eating, potentially using drugs or alcohol. There's various different things that we could be doing, which again, maybe not so bad in the short term or now and again, but if we're doing it often, you know, let's imagine we're getting lots of those triggers, or for some people it doesn't even have to have a trigger, they just get stuck in that depressive cycle and, you know, it can be really hard to break out of that cycle, which is why it can be really helpful working with a CBT therapist to talk about those patterns and then for the CBT therapist to give you a plan to break out of that vicious cycle. And there's various different strategies that we can use to help you. And if one doesn't work, that's okay. We can try a different one. Honestly, there's lots in there. You know, CBT therapists, it's like we've got a toolbox of lots of different tools. There's not just one or two in there. Honestly, there's hundreds. And yeah, once you are working with an experienced CBT therapist, it becomes a lot easier to pick the tool that we're going to provide to the client. When you're a new therapist, it's a little bit more trial and error. Like, yes, we are competent. We've had lots of practice at uni and with certain clients when we're training. But once you become a competent CBT therapist, and this can, you know, over many years, I've been doing CBT for 8 years now, it becomes much easier and quicker to see what's going on with the client and think, right, this is most likely to work or this one isn't. But maybe I can talk a bit more about competence and things in another video. So yeah, with a depression client, if they have been avoiding for quite some time, it could be quite difficult to break out of that cycle. So, you know, we want to start off small and get some small wins so it feels good. If we set something too challenging and then we're not able to follow through with it, they may then even feel worse about that. And it'll be like, right, well, now nobody likes me and now my therapist hates me and I failed the therapy, which obviously we know isn't true. But we want to make sure we set SMART goals. So within CBT, we really want to be looking at SMART goals, not just random goals, not big goals. I mean, that might come later down the line, but SMART. So specific, measurable, achievable, realistic and timed. We want to set a time limit on it. So I say to my clients, you know, what's your goal in the next couple of weeks? What's your goals within the next couple of months, maybe slightly bigger goals, and then what would be your goal in, you know, 1 year, 2 year, even bigger goals then. Okay, so just to summarise, depression cycle, we're looking at quite a lot of avoidance, we're looking at those negative thoughts, most likely some sort of isolation. So what we want to do with the CBT is kind of break out of that. So start adding in things that are going to make us feel good, thinking about self-care, thinking about hobbies, thinking about exercise. I know I bang on about this a lot with my clients, but exercise is really, really, really important. But there's many other things that we can do within the CBT as well as exercise. And then, yeah, we'll make a plan. So we'll use mainly a technique called behavioural activation, which will work on changing the behaviours. And then we will use a technique called cognitive restructuring, which looks at managing those really negative thoughts that we've spoken about earlier. So hopefully that makes a little bit more sense to you guys. If you want more information on depression, definitely drop me a message and let me know what you would like me to go into more detail about. Yeah, that would be great. So let's think now a little bit more about an anxiety cycle. So let's think of a trigger for maybe some anxiety. Okay. Let's go with this one. So let's say we've got a big party coming up. So it's a friend or family member's birthday, or you've got a wedding, something like that coming up. These situations can create a lot of anxiety for people. You know, there could be some social anxiety, some general anxiety, it could be low self-esteem. But I think for now, let's just focus on a kind of general anxiety. So some people may have certain thoughts with their anxiety that may be like, I'm worried nobody's going to talk to me. What if I can't find something nice to wear? What if people who haven't seen me in a while think I've put on loads of weight? What if I can't find anywhere to park? So there tends to be a lot of like, what ifs, what if that, what if this, what if that, a lot of future-based things. So, you know, it could be miles away, you know, and we're already worrying about it. And then what would happen is those thoughts would then lead to certain behaviours, right? So it may be that we can't sleep at night because we're worrying. Maybe we put off planning because we're so worried and we're so overwhelmed, we just can't face it. So we avoid searching for the dress, we avoid booking the hotel, we just try and push those thoughts away. It's a bit like having a beach ball. We're just trying to push all those worries down. But what happens, right? That beach ball just keeps coming back up. So pushing it down, we don't want to think about it, and it keeps popping back up. And this is kind of the cycle of the thoughts and how it's making us feel. And we can feel really distressed actually with anxiety. We can feel very tired. You know, it can literally be exhausting, just going round and round these things in your mind, almost pushing that beach ball down all the time. So what we want to do within CBT is actually take that beach ball out of the water and have a good look at it. We don't want to be trying to avoid it. We don't want to be trying to suppress it. We don't want to be seeking reassurance from everybody else. We want to take it out and we want to look at it. So we want to look at those worries. You know, is there any evidence that these people really aren't going to like you? You know, maybe they will. Maybe they might think you look great and be really, really polite. Who knows? But the thing is with the worry, we don't know because there's that uncertainty there, right? So we want to look at them. And what we do within CBT is categorize them into two different types of thoughts. So we love categorizing thoughts in CBT. This will come up a lot, but this is just one example because there's lots of different ones. So one example that I'll give you in terms of the treatment for the CBT for anxiety is labeling the worry. So either it's a practical worry, something that's going on right now that maybe we can do something about, right? So, we know that the car needs some new tyres and we're driving to this party, so we need to book it into the garage and get the tyres done, right? Practical problem. There's a solution, we just need to book it in or pop it on the calendar. Now, the other type of worry we see within anxiety is something called a hypothetical worry. So as you guessed, this is not a practical problem. I like to say it's not real, but the thing is, sometimes for the person that is experiencing it, it does seem very real. And, sometimes these things may happen. It's just, so they are real. It's just that it hasn't happened right now. So this is why they're hypothetical, because it may or may not happen. So, worrying about whether anybody's going to talk to you at the party is maybe a little bit more of a hypothetical worry. When we really think about it, it's probably quite likely that some people are going to talk to you at the party. But this is just a hypothetical worry, and it tends to be quite negative. We don't tend to be worrying about all the nice things that could be happening, right? It tends to go straight to the negative, and that makes us feel bad, and that's why we want to look at it within CBT. So if we think about the anxiety cycle, we want to look at those thoughts to reduce the intensity of them so that you feel a bit more relaxed and the thoughts aren't so scary. And then hopefully this would have a positive impact on, your sleep and your relaxation. Because if you're anxious, you're going to be panicking, you're going to be restless, you're going to be exhausted because you're not sleeping well and you're just worrying. So breaking out of that cycle of those negative thoughts and that repetitive worry can make you feel better. And yes, your CBT therapist can help you do that. Now this one, it really does take a lot of practice. I know from experience, because I used to be quite a lot of worrier, that skill of worrying, you've probably practiced it over and over and over again. So you know what, you're probably quite good at worrying. So with some of my clients, I kind of joke with them and I say, you know what, you could have a PhD in worrying. You're so good at it. But the issue is that worrying makes you feel unwell, right? So let's use the CBT to learn about worry and practice the strategies to break out of that vicious cycle so that you can feel better. So that's the anxiety example. I could speak a lot more on this and really go to town, but I think for today, I'm just going to focus on those main points. So, what to do if you would like to work with a CBT therapist and you would like some CBT? So, one option is that you can go to your GP. Especially here in the UK, there's lots of services all over, so it's probably quite likely if you go to your GP, they are working with a local service via the NHS that they can refer you to. And, within the NHS, all the therapists have really good training, that they've had a lot of practice, so you can be, confident that you're going to have a good treatment. Now, if maybe you don't want to go to your GP or the wait list is a little bit long, you can look into private therapy and you can find therapists online who will specialise in different things. So yes, you can do a little bit of a Google search, and my recommendation is to find somebody who is accredited. So mainly you want to look maybe on the BABCP website. So this means that people have had really good training. They've been to uni, they've done their undergraduate most likely or something similar in psychology or CBT, and they're practicing within the guidelines. So they're having regular supervision, they're keeping their trainings topped up, they're working within their boundaries and things like that. There maybe are other therapists out there who are not accredited and maybe they haven't even been to university or done the proper training. So I'd be mindful of those therapists. I mean, there might be some really good ones out there, but I'm just saying to be mindful of that, because there may be a possibility that they've not had the correct level of training and you might not get the standard of CBT that you would like and that you deserve. There are also local charities where you may also find certain therapists that offer CBT. So I know Mind is a really lovely charity, and there are therapists that work there who may offer CBT. And obviously you can find lots of information online. There's various books and manuals and things like that. You know, Amazon can be a really good place to find certain CBT books. Again, just make sure that you're checking the credentials of the books that you're purchasing. So for example, with depression, you maybe want to be looking at books by Beck, and things like that. But again, if you want more information on that, I can do a whole video on like different books, recommend different therapists and things like that. So I think that is all that I wanted to say on this video. So I hope you liked it. I hope it's I hope it makes more sense to you guys what CBT is, what it can help with. And yeah, if you guys have any questions about anything that I've said in the video today, then please drop me a message and a comment. Also share what you liked, what you didn't like, and yeah, maybe give some ideas of other videos that you would like me to do. All right, thanks for coming, guys, and yeah, hopefully see you soon. Bye.